welcome back to another episode of Healing Our Community with Dr. Ray and Jean. Hi, I'm Dr. Ray.
And I'm Jean.
This podcast, Healing Our Community, was designed to engage in conversations about mental health on the Western Slope and specifically in Delta County. This podcast airs live 12:15 every Wednesday. Rain, snow, sleet, or even smoke. And today we are on location at the Delta County Sheriff's Office, and we have our guest here, our Undersheriff Quinn Archibeque. Did I say that correctly?
You did.
Okay, awesome. Yes, and this is a very vital conversation that we are going to have here. But before we do that, we want to address the elephant in the room. As many of you know, Undersheriff Archibeque is currently on the ballot for Delta County Sheriff, and we want to be completely transparent with our viewers. Today's episode is absolutely not a political endorsement or a campaign stop. We are here at the Sheriff's Office strictly because Quinn has decades of unmatched frontline experience with the mental health reality in our county. And our focus today is purely on public safety, community wellness, and learning from his institutional knowledge. So we're leaving politics at the door and focusing on the wellness of Delta County. This is live, so if you have any questions or comments, please feel free to put it in the comments section if you're watching on our Facebook page or even on our YouTube channel. So without further ado, I want to introduce and talk to you, Quinn, about mental health here. As I mentioned, you have decades of experience in local law enforcement. One question I have for you, just to kind of start us off, is like, how has the nature of 911 calls shifted regarding mental health here in the community?
Even as far back as when I got started, I can remember specific mental health related calls. Our approach to those then was much different than it is now. We have limited resources now, but they were even more limited back then. And over the years, these calls have progressed. We're seeing, calls from people that's generations, children, grandchildren, stuff like that. And the calls are increasing to the point where I looked at some numbers this morning, and just yesterday, a third of the calls that law enforcement within Delta County responded to had some type of underlying mental health component.
A third.
A third.
Wow.
And that's fairly typical, to be fair. I didn't, go back days, weeks, months, anything like that. I just wanted just a quick snapshot of where we were at right now. And a third of our calls yesterday nearly had some kind of an underlying mental health component, whether it be something as simple as, a trespassing where somebody was on their property and maybe they were confused or having a crisis. Calls involving a 9-year-old child in crisis. Actual suicide attempt where somebody took some pills. So that was the range of mental health related type calls that our law enforcement dealt with just yesterday.
Wow. I know the numbers are really staggering, and before we went on air, we were talking about this documentary that we just saw. What was the title of it again?
Paradise Paradox. It's
Paradox.
on Amazon Prime, and it was filmed in Vail in their response to mental health issues that are specific in Colorado, where the suicide rate is 3 times the national average.
Yeah, and they were specifically saying that this problem is isolated to mountain towns.
Yep.
Because of the isolation, because
Of the altitude. And doing extreme sports and having that high and then crashing.
Yeah, so there are a lot of different factors that they were identifying, but just that mental health is not just a problem here in Delta County, but it's widespread across the state of Colorado. And as I mentioned, we are 49th when it comes to mental health providers in this state, which is really terrible. If
49th out of 50 states.
Out of 50 states,
Yeah.
Right. And so, if we have this high mental health crisis and we don't have actually workers to do any of that work, it's really a big problem.
Yeah.
Yeah. So I imagine that your deputies kind of turn into crisis counselors from, having to respond to a third mental health calls.
Yeah, they really do. I was reading one particular report from yesterday, and I think the deputies did a fantastic job developing a rapport with one of the citizens that they interacted with, who was being initially very uncooperative, almost aggressive towards the deputies, and they took the time to de-escalate that situation, talk through the issues, and ultimately ended up, giving them a ride to where they needed to go, and everything was resolved how it should have been resolved. So our approach to this is much better than it used to be.
I know a lot of communities, they employ co-responders, right, which would be a mental health provider that, rides along with the deputy and responds to a mental health call. And I know resources are very thin, right? And so, how has the sheriff's office kind of evolved to trying to work with mental health providers in the area? And, does the sheriff's office have any plans in the future of developing that?
I would love to have in-house co-responders. I'm a huge believer in the co-responder model. I believe that it's very beneficial to the citizens and to law enforcement. Unfortunately, due to budget constraints, it makes it extremely difficult to do that. There's some providers locally that do provide co-responders or case managers, licensed and unlicensed, and they get overutilized, for their coverage areas, so it makes it extremely difficult. And because of our area that we live in, cost of living versus where salaries are at, it's extremely difficult for these providers to attract and retain qualified people. And so we've seen a lot of co-responders, case managers, those type of people come and go over the years. And it seems like once we just really get our feet under us with a co-responder, they go somewhere else or something else comes up. And so, I would love to have a model, like Mesa County or some of these larger offices, to where we have a co-responder, but it's just simply not in the cards right now.
Yeah.
I really think, based on, what I was looking at yesterday, that we could most definitely keep a co-responder or 2 or 3 busy. So I wish we had that ability. I wish we had a more robust co-responder program here locally, even if it's a third party, obviously, kind of like what we have now, because we utilize that and would utilize that a lot.
Yeah, I think it's definitely needed.
Oh,
Yeah.
100%.
Do you see patterns like where things are quiet and then all of a sudden there's a lot of activity?
Yeah, these things, like any call that law enforcement deals with, it seems like they kind of ebb and flow. You expect to see more mental health crisis calls around the holidays, or special events in their lives that may, cause a trigger or something like that. But it seems like, again, looking yesterday, maybe that was kind of at the peak for the month, and it's been low ever since. I didn't look at all those numbers, but we definitely see, patterns in groups and different things. And, sometimes we expect something around Christmas time and it doesn't really happen, but it does in February. And, I certainly can't explain it. I don't know if you guys can, but it doesn't really make any sense whatsoever. I seem to see more mental health related type calls, in the wintertime when people can't get out, which is interesting compared to what you guys are saying with, the increase due to the outside sports in Colorado and stuff like that. Gloomy days like today, it just brings everybody down. And if you're already facing something, is that going to be enough to push you over into crisis? It may be related.
Are there times of day, like are evenings busier than mornings, or it doesn't matter?
No, not necessarily.
Interesting.
Like yesterday, I looked at just those calls yesterday were mostly during the day shift time. A lot of times what we'll see going into the evenings or late at night is people who are maybe in crisis or feeling kind of low, and then they self-medicate or they add alcohol to that situation,
yeah.
and then we'll get those calls later in the evening.
Right, yeah. So, with your deputies having to, take on the crisis, How do they handle that? You know, is there any specific training that you're doing for them to be able to handle those calls? And then also, you know, one thing that we've talked about in past podcasts is that the emotional baggage that we all take on, I imagine it's just tenfold, you know, for your officers.
Oh, absolutely. Absolutely. Yeah, you know, we get everybody, especially in patrol, and it's kind of expanding out now to crisis intervention training. Everybody goes through de-escalation training. Not only is it's state mandated, it's mandated through our office, and it's just a good idea to know how to de-escalate situations. The crisis intervention training gives the law enforcement the tools to maybe recognize, is this somebody in crisis? Is this a substance abuse issue? You know, could it be a traumatic brain injury issue? How do we need to approach this situation to best help this person? So through those trainings, I think it's given law enforcement a lot more tools than they had, you know, even when I was on the road. I think historically law enforcement's approach to mental health, even, you know, 20 years ago, was great considering, you know, the training and the resources. You know, just by default, we were forced into situations where we had to learn how to de-escalate and how to you know, address these situations, how to triage people and find out where they're at. And I think historically law enforcement's done a great job with that. You know, it's much better now that there's actual training, there's actual recognition with some of these things, and there's actually more resources like a co-responder model or something else to step in and say, you know what, no, I think we need to go down this path rather than assuming it's this path. So.
You know, we have seen a huge shift in the mental health field since COVID, when everything had to go virtual, and then, you know, after that, the after effect. I was wondering if you have seen any change here, or the evolution of mental health since COVID here in the county.
You know, I think it's actually possibly declined. You know, we got too comfortable through COVID with, you know, telehealth and virtual type things rather than face-to-face conversations on a lot of levels. And then, you know, you take people who are in crisis or on the edge of crisis or are trying to deal with something, and then that socialization piece was swept out from underneath them, and maybe they felt isolated. They didn't feel like they had somebody to talk to or could go to somebody to talk to through that process. So, you know, I don't, to be fair, have anything to really back up what I'm saying, but, you know, just based on what I've seen, I think that was a huge factor on a lot of different levels.
You know, one thing that we've really talked about, you know, with KBH working at Riverbend and everything is the loop, right? The cycle. And, you know, someone who is in a mental health crisis, it may be they're taken to the ER. If they don't meet criteria for hospitalization, then they go back into the community, right? Maybe they get a referral for sessions, certain number of sessions with behavioral health over at Delta Health or with another provider in the community. But there isn't anything that kind of bridges the gap in between, right? It provides more long-term stabilization. I was wondering what you think is like the missing link, right, in the system to kind of break this cycle.
You know, the mental health system in Colorado is a multi-billion-dollar taxpayer-funded train wreck, in my opinion. You know, the bureaucracy and all the hands in the pot with this thing, I think it comes at the expense of the people who really need those resources. Again, that's just speaking from my experience and looking from the outside into your world. But, you know, the next level of care is horrendous. You know, when we have good co-responders, when we have people here that we can utilize as a resource, you know, our response to crisis through our training and through those resources is really pretty good. It's that next level of care. Like you said, our only option right now, if somebody's in crisis, is to take them to the hospital and hope to have an M1 placed on them where they can be evaluated and go from there. That's really all we have right now.
Right.
Beyond, maybe a telephone visit with a caseworker
Yeah.
or a co-responder being on duty or something like that. We just have very, very little options. And it translates over to our jail population as well. The people out there who are suffering from mental illness or in a crisis, they may be committing low-level or serious crimes that's going to end up getting them charged and put in jail. The criminal justice system isn't equipped to deal with mental health. They're equipped to deal with criminal offenses. And so people who are arrested for a crime, any crime, and they are not able to assist in their defense, they have to sit and await restoration. And that takes an unfair amount of time. We have people in our jail, numerous people at any given time, who are in there for criminal offenses, but they're awaiting a competency evaluation, they're awaiting restoration, they're awaiting something to move their case forward to the next level. And more often than not, I believe that they spend more time in jail awaiting that process than they would if it was me and I went in and was just immediately able to plead guilty and get my sentence for the crime that's been committed. And that's just another piece of how broken our system is. Legislation has made it clear that, look, this isn't fair. And so you have X amount of time to get this evaluations done. You have X amount of time to do this, otherwise you have to pay a fine. Well, the way the system is set up, the people who have to pay the fine pay the same person. They take money out of one pocket and put it in the other pocket. So that ends up what's happening. And the end result of that is, a victim of this crime is sitting there in limbo, waiting for closure, waiting for, their voice in court if it ever happens. And the suspect sits in jail for an unfair amount of time before their case is heard in court. And it's just, it's just not right. I think that the jail is a excellent place for anybody who victimizes our society or who is the public safety risk. It's not the appropriate place for somebody suffering from mental health.
Absolutely, yeah. Now, how do you address the mental health of your officers in the department and making sure that they are, healthy and not taking on all of the stress and pressure?
What was the statistic that most people have 2 to 3 traumatic events in their life?
Yeah.
And police officers, what was it, 168 or something?
Right. It's exponentially higher.
Yeah.
This is kind of new to us. When I was appointed Undersheriff almost 8 years ago, it's a path that I wanted to take. It's something that I wanted to explore because we really didn't have anything. And so I tried several different avenues. I met with various obstacles, some of it from the people, some of it from other providers, and it just never really came to fruition. I through circles with my peers, other sheriffs, other undersheriffs, I talked to them about how did they get this started, because we need to start somewhere. And I got a lot of good advice, and I kind of followed that stuff. I looked at different things like an app that people could put on their phone that could just kind of a check-in kind of thing, and nobody was interested in that. And so, I went through a lot of different things, and how we would apply this would be as if a traumatic call, a death of a child or something like that. We would put together some kind of a debrief with a peer support group or with a mental health provider, and give the deputies, the dispatchers and stuff the opportunity to talk through some of these things. It always bothered me that there wasn't more substance to that, and there wasn't something, something more proactive rather than reactionary to a call. So, through my relationship, starting with you guys now, I'm very positive that we're going to be able to try to get headspace a little bit better going into some of these calls, rather than dealing with the aftermath of what they've seen or what they've done. And this isn't unique to the patrol side who obviously sees horrible things. I mean, everybody has to remember these calls start with our communication center, with our dispatchers.
Right.
Our dispatchers are the first ones to hear the chaos and hear the trauma and have to try to navigate that. And a lot of times, once they pass that call on to law enforcement, they don't know how it turned out.
Right.
And so they don't necessarily always get that closure. And you talk about people who are in our detention facility, whether it's mental health issues or criminal issues. Our detention staff, 40 hours a week, are housed with these people, with these inmates, and so they have to see firsthand somebody who's in jail suffering from mental illness and how they languish in jail because of that. And so what we've seen is people who are in that situation rapidly deteriorate. And our deputies over at the jail have to watch that happen. And so that's extremely difficult for them. Our administrative staff, our records staff, our victim services staff, I mean, they have to read these reports. They have to review the body camera. They have to navigate this stuff as well. So I think that trying to provide some kind of a system where everybody has a resource that fits their individual needs or their individual response to what had happened is extremely important. I'm not to the point where I'm going to make anything mandatory, check-ins, stuff like that. Right now, there's a lot of services, which again, I'm appreciative for you guys for providing, where they can voluntarily, do these check-ins and stuff like that. And I feel like that's where we need to start. We need to start with something. I have to offer them something.
Yeah.
I know from my experience how calls affected me over my career, and our response to that back then was, you deal with it and you move on to the next call, and that was an inappropriate response. Mm-hmm. And so, I try to be extremely open, extremely vulnerable to anyone who asks, and especially my staff, about how that has affected me over the years and my relationships with family and friends and stuff like that. And bottom line is, I just don't want, nearly 30 years later, for any of my staff to look back and say, that kind of screwed me up, and I wish I would have had a way to unpack that. So I'm trying to provide that. And the climate of law enforcement and mental health as far as self-care, it's better than it was. It's a lot better than it was. It's not nearly the negative stigma that it used to be. And that helps considerably, because the younger generations coming into this field, it's almost like they will seek it out, they crave it, they expect it more than are resistant to it. And so that's positive to see, and I really want to nurture that and make sure that they're taken care of. And beyond that, I firmly believe that if the staff feels healthy, supported, has the resources they need at work, it's going to translate over to their personal relationships. Mm-hmm. It's going to translate over to how they interact with the public. And so I think it's a win-win for everyone.
Absolutely.
Yeah, absolutely. Yeah, the military, they have done a lot of research and have put a lot of resources into implementing mental health treatment, for soldiers coming back, because they know the trauma and the impact of trauma, not only on the person itself, but also the family, mm-hmm. right? And so, I think that people are starting to understand, what the impact on, law enforcement is.
I think also there's been a nice division between mental illness and mental health.
Yes.
So, it used to be if you sought out services, you had a mental illness.
There was a problem, right?
Right, and now people are much more savvy about mental health, and it's not so easy to identify when there's an issue. Like you said, you go through a big trauma, okay, that's important to debrief that, but 6 months later,
right.
and it comes out kind of sideways. It's like you look at kids going through stressors, their grades are going to suffer, their diet's going to change, their sleeping patterns. It's not going to be like they're talking like I'm sad,
Right. No, 100%. Yeah. And I think it's a vicious circle, because the same issues that can develop in this line of work can also develop at home and come to the line of work. Everybody in the world has a bias. Whether you want to acknowledge that or not, everybody has a bias. And so if somebody has a bias at home against child abuse, domestic violence, drugs, driving while impaired, one of those things, that most definitely is going to come to work, and we see that with our law enforcement staff, that's kind of their primary focus. And so those things work both ways as well, you know, and through again the relationship with you guys, I really appreciate the fact that you're willing to open this up, you know, through grant funding and through our relationship that also include spouses.
Absolutely.
And I think that if they're happy and healthy at home, they're happy and healthy at work, and vice versa. And I know, you know, again from my experience, that law enforcement doesn't necessarily share with their families what they go through, because they're trying to protect them from
For
that.
sure.
Right.
Yeah.
And rightfully so.
Yep.
You can't go home and tell your wife or your young kids, hey, this is what I did today, because it's, you know, talk about messing somebody up.
Yeah, it caused vicarious trauma.
Exactly. And so there has to be a way for the spouses to understand that, and there has to be a way where law enforcement and families learn to communicate these things in a healthy way, rather than what I've done in my past, and that's go home, shut off, and not want to talk to anybody, including my family. And that does not translate over to a healthy relationship whatsoever.
Absolutely, right.
And you know, to be fully transparent again, I'm still guilty of that. It's something I have to consciously work through every single day, because it's just ingrained in us to.
Yeah.
And the interesting thing with the female brain, you're talking about the wives, and obviously there's husbands too of officers, but she's going to be like seeking, like, something's wrong, must be me.
Oh yeah.
And and have no idea that you're going through something completely different. But that kids too, that's how they're going to translate it, that it's me.
Absolutely, and without anybody telling them, you know, look, it's not you. You know, this is why this is.
Yeah.
It never gets resolved, and then that's why you see, you know, families breaking up, divorces.
Yeah.
That's why you see, you know, alcohol abuse in law enforcement. That's why you see all of these things. It's just they don't know how to, you know, decompress this in a healthy way.
So, you know, if you had a magic wand, and
That would be scary.
everything could be the way you want it to be in the county, as far as in regards to mental health, you know, not just out in the community, but also within the department here and seamlessly throughout the county, what would that look like for you?
You know, we have to have more resources available
Yeah.
to the community, and that translates over, obviously, our staff is part of the community. We have to have more resources, you know, the regional resources, the bureaucracy that goes along with some of that stuff. It just has proven to not be sustainable. You know, a center in Grand Junction or a center in Colorado Springs, it's just not viable for us in Delta County. We have to have something, a resource that's more localized, that understands the community, understands the citizens, understands some of the issues that we're dealing with. I would love to see something like that. You know, I'm not asking for a multi-bed center or anything like that. You know,
Which would be nice.
Just something.
Yeah.
You know, just something that we can refer people to, so that our law enforcement is not having to place someone in handcuffs, put him in the back of a patrol vehicle to transport him to a hospital to be evaluated. I mean,
Right.
that's not healthy for anyone.
Right.
Yeah.
You know, it takes our law enforcement off the street from dealing with criminal issues, and it's, you know, it certainly can't be healthy for those who are already in crisis to have to go through that. You know, it has to be that way. We have to make sure our staff is safe during this transport. I mean, it has to be that way, but it's not ideal. You know, we have mental health transport services through our local ambulance, which has helped considerably with that kind of stuff. It softens that up. It's absolutely the appropriate thing to do. But if this person's going to be combative or something like that, again, we can't put our EMS staff at risk either. And so we have to act accordingly. And so, yeah, I would love to have, you know, a next level of care. You know, I'd love to have the initial crisis piece of it to the point where if our deputies get a phone call, we have a co-responder model. We have something that can take that burden off of our staff having to make that decision and try to talk somebody into going with them down to the hospital. I would love to relieve the burden on the hospital. You know, just like mental health is not necessarily a law enforcement issue, mental health isn't necessarily an emergency room issue either.
Right.
You know, and so,
Right.
so we're taking away resources from them as well. And that's a huge problem
Yeah.
as far as I'm concerned. And I know it's, if you talk to them, they would absolutely agree with that.
Absolutely, right.
So there has to be something different. There has to be a better system, a better way to approach people who are committing criminal offenses with the underlying issues of mental health. You know, we have to get better at identifying that, not pointing fingers. Excuse me. I've seen over the years, you know, the mental health world say, no, this isn't our issue. He has a traumatic brain injury. And so you go over to the medical people, and the medical people, I don't think so, because this is a substance abuse issue. So you go to the substance abuse people, and they're saying, I think we got a mental health issue. And meanwhile, this person is just out on the street in the wind,
Yeah.
Yeah,
and
Yeah.
and nobody's doing anything. And so we just need to get better about all of those things.
absolutely. Yeah, you know, ideally, it would be set up very much like Mayo Clinic, where they have all the disciplines there, and the person, you know, is seen by an entire team. And then as a team, they're able to treat and help that person. Ideally, I mean, that would be my magic wand, right?
And I think we have that. We have the ability to work towards something like that if we can just get all of the stakeholders at the table and have them communicate, not be territorial, and just work for the greater good of this population, rather than, you know, maybe self-serving a little bit.
Yeah.
And that's kind of been an issue in the past, and it's unfortunate because then people will also still fall through the cracks.
It's
Well,
tricky.
yeah, it's very tricky,
Yep.
very complicated, but actually very exciting for us, you know, to be kind of at a ground level of trying to help build some systems and infrastructure that's necessary here.
I'm very excited. I'm very thankful of everything that, you know, we've already accomplished through our partnership with the Sheriff's Office and KBH. It's been huge so far, and I really look forward to what the future brings with that.
Absolutely, us too. Well, Quinn, we want to thank you so much for being on our podcast today.
Thank you. It's my pleasure.
I think this is some really important information that our community should know about, right? Because it takes real talk and real conversations to enact real change. And so let's keep talking, Delta County.